Good day, everyone. My name is Christina Lam Sumawang, and I am a student nurse from Tarlac State University from BSN 1B. And for today, I will be performing a performance checklist about the transferring of the patient from bed to chair or wheelchair. So the goal of our performance is that the transfer is accomplished without injury to the patient or the nurse, and also the patient is free from any complications of immobility. So now we will proceed to our procedure. So first thing that we need to do is we need to assemble our equipment. We do need to have a chair or a wheelchair. Also, we do need to have a gait belt as well as a stand assist device if available. And we will be needing also a additional nurse or additional person, staff to assist, and we will be also needing a blanket to cover the patient in chair. And after that, we will be also needing a non-sterile gloves and other PPE as indicated. So now we will proceed to our implementation phase. So first thing that we need to do is we need to review the medical record and the nursing care plan for any conditions that may influence the ability of the patient to move or to be positioned. Next is we will be assessing for tubes, IV lines, incisions, and other equipments that may alter the positioning procedure. And after that, we will be identifying the movement limitation of our patient. And for our second step, we need to perform hand hygiene and observe other infection control procedures. And also, we will be putting on our PPE as indicated. And for our third step, we need to introduce ourselves to our patient, and we need to verify the patient's identity, and also we need to explain the procedure with our patient. So here's an example. Good day po, my name is Christina Lam Sumawang and I am a student nurse from Tarlac State University, and today po I will be your student nurse. And ma'am, may I know your name po? Okay, thank you po. Pwede ko po tignan niyo pong list tag? Thank you po. So today po, I will be assisting you in transferring you po sa inyo pong bed to the wheelchair po o kaya po sa chair. Is that okay po? Okay, thank you po. So for our next step, we need to move equipments to make room for the chair, and also we will be providing some privacy for our patient by closing the curtains around bed and closing the doors to room if possible. And for our fifth step, we need to lower the position of the bed in the lowest position, and we need to raise the head of the bed to a sitting position or as high as the patient can tolerate. So for example, I have already adjusted the bed in the lowest position, and let us assume that I have already placed the head of the bed to a sitting position. We will now proceed to our next step, which is we need to make sure that the bed breaks are locked, and also we need to place the chair. We have already placed the chair next to the bed, and after that we need to make sure also that the chair on the lock on the chair or the brakes on the chair are also locked, and if the chair doesn't have any locks or brakes, we will be bracing the chair against a secure surface. So let us assume that I have already checked and locked the brakes of both the chair and the bed. We will now proceed to our next step, which is we need to encourage our patient to make use of the stand assist device, either by freestanding or attached to the side of the bed. After that, we need to move the patient to the side and to a sideline position, facing the side of the bed towards which he or she will be sitting. Ma'am, pwede po bang ano po ang inyong pong position po? I-move po lang po kayo sa isang sideline position po. Is that okay po? Thank you po. Okay. Now we will proceed to our next step, which is we need to have the nurse to stand on the we need the nurse on the side of the bed to stand at near the patient's hip, and also we need to with the foot of the nurse spread at about shoulder width, and with the nurse foot on these near the head of the bed and slightly ahead of the other foot. And after that, we will again encourage our patient to make use on the stand assist device, and we need to assist the patient to a sitting position and or to a sit up and on the side of the bed, and also we need to ask the patient to swing his or her legs on the side of the bed. Ma'am, pwede niyo po bang i-swing po ang inyong pong legs? Okay, so let us assume that the patient is swinging his or her legs. After that, we will need to pivot our legs to lift the patient's trunk and the shoulder of the patient. And after that, we need to straighten our back so we avoid twisting. And after that, for our 10th step, we need to stand in front of our patient and we need to assess the patient for any balance problems or any complaints of dizziness. And after that, we need to allow our patient to dangle his or her legs in about few minutes before continuing. So, ma'am, meron po ba kayong, nahihilo po ba kayo ngayon? Hindi naman po. Okay, thank you po. So, hindi naman po ba kayo nanghihina? Hindi naman po. Okay, thank you po. And for our next step, we need to assist the patient to put on a robe as necessary and also a non-skid footwear. So let us assume that the footwear has already been placed on the patient's foot. We will now proceed to our next step. We need to wrap the gait belt on the patient's waist. And After that, it is based on assess needed and facility policy. Ma'am, ilalagay ko lang po yung gate belt. Thank you po. And for our next step, we will need to stand in front of the patient with our feet spread apart at about shoulder width, and after that we will need to flex our hips and our knees. And for our next step, we need to ask the patient to slide his or her buttocks on the edge of the bed, and after that until his or her feet touches the floor. So for example, the patient's feet has already been placed or touched the floor. We will now proceed to our next step, which is we need to position ourselves close to the patient as much as possible, and also we need to position our foot on outside the patient's foot, and also if the second staff is assisting, we will need to have him or her to assume a similar position. So for our 15th step to our 17th step, first I will be stating first the procedure before doing the actual transferring of the patient to our chair. So for our 15th step, we need to encourage again our patient to make use of the stand assist device, and if necessary, the second nurse or the second person staff should grasp the gate belt opposite to the gate belt opposite side, and we need to use the gate belt to assist the patient in to stand. And after that, we need to rock back and forth, and we need to count 1 to 3. And after that, we will, on the count of 3, we will be using our legs, not our back, to help the patient in a standing position. And if indicated, we need to brace the patient's knees against his or her weak extremity as he or she stands. And also after that, we need to assess the patient's balance and as well as the leg strength. And if our patient is weak and unsteady, we will be returning the patient to the bed. And for our 16th step, we need to pivot on our back foot against the patient until for our 16th step, we need to pivot on our back foot to assist the patient to turn until he or she feels the chair against his or her legs. And after that, we will now proceed to our 17th step. We need to ask the patient to use arms to steady him or her to the arms of the chair. And after that, while slowly lowering him to a sitting position. And after that, we will need to continue the bracing of our foot or our knees to our uh, bracing the patient's knees with our knees, and we need to use or to hold the gait belt. And after that, we need to flex our knees and our hips to help the patient to sit in a sitting position in a chair. So now we will now do the procedure of the 15th step to the 17th step. So ma'am, ililipat ko na po kayo ngayon sa ating pong chair. Pwede niyo po bang hawakan yung shoulder ko? Okay, thank you po. So let us assume that the patient is holding my shoulders. Okay. 1, 2, 3. Yep. Now we will proceed to our 18th step. We need to assess the patient's alignment to the chair, and also we need to remove the gait belt on the patient's waist if desired. Depending on the patient's comfort, it could be placed or left in place for using on the returning of the patient to the bed. And after that, we will need to cover the patient with the blanket. And after that, we need to make sure that the call bell or other necessary items are within easy reach. So for our last step, we need to clean transfer aid as per facility policy, if not indicated for single patient use. And after that, we will be removing our gloves and our PPE as indicated. And after that, we will be performing hand hygiene. So for our evaluation, the patient transfers from bed to chair or wheelchair without any injuries and exhibits no signs and symptoms of problems or complications related to immobility. And also, in addition, the nurse remains free from any injuries during the transfer. And for our documentation, we need to document the activity, which includes the time, the length of time the patient sat on the chair. And also, we need to document the any pertinent observations, as well as the patient's tolerance of and reaction to the activity. And after that, we also need to document the aids used, as well as the numbers of staffs or nurses required for the transfer. And that would be all for the assessment of the transferring of the patient from the bed to the chair or the wheelchair. Thank you.